So, how the patient comes to a doctor, what is the problem which happened to the patient? I'll explain you. So, usually they get pain in the hip joint, one. Two, sometimes they get a pain in the back, or sometimes they get the mainly pain in the knee joint because the hip and the knee is supplied by one nerve, which is very common, and you can get a referred pain. So, patient comes with the knee pain, and we see the patient, there's no knee problem, and we suspect that hip could be a problem, and we do an x-rays or other investigation and find out the reason for a pain, and sometime it is very obvious that it turn out to be a vascular necrosis of the hip. A vascular necrosis can happen in any of the joints. It can happen in the shoulder, it can happen in the knee, it can happen in the ankle joint and other joints of the body, but most common in the hip joint. Now, when the patient comes to a doctor, doctor examine the patient, do some x-rays, and in a very early stage, in x-ray, you do not get any changes at all. So the earliest diagnosis can be done if it is suspected to be an AVN, avascular necrosis, by an MRI of the hip. Once the MRI is done and the hip has been diagnosed as avascular necrosis, it's really a time where one has to be very careful, because this avascular necrosis is a very progressive disease, and not all kind of avascular necrosis progresses, but the main avascular necrosis like alcohol induced or steroid induced avascular necrosis, they progresses very fast and damage the hip joint. So once it is diagnosed, the initial modalities to prevent the hip joint damage by a conservative way of treatment is very important.